just gather your attention again. Thanks for coming back here and eating. This is company meeting part 2.
Yeah.
But this is a very important part of the meeting because right now is the month of August, and it's our month of open enrollment for insurance selections. And so we need to go through this every year so that everybody knows what insurance we have available and some things that we're adding this year. You'll notice each one of you had a little brochure there from Hoops Vision. Hoops came in and contacted us and want to offer out a corporate discount to all of our employees if you select to go through Hoops Vision to get LASIK or anything like that. They will give you a nice discount that you wouldn't be able to get anywhere else. So this is another benefit we're adding to it. Nothing you have to buy, just for being an employee, it's open to you. So make sure that you take that brochure. But let me introduce you to 2 gentlemen that are here with us. Nate Peterson from BIG Benefits and Justin Harward from OneSource Business Solutions. They're each going to take a few minutes just to talk about the offerings we have, answer questions, and make sure everybody knows what they need to know. So who wants to go first? Nate?
All right. I'm up.
There you go.
Okay. Do I need to smile for the camera back here? Is that what it is? All right. So a lot of you look familiar, some of you don't. That means that Achieve Today is growing, which is fantastic. Good for them, good for you guys. It's a privilege to work with Achieve Today. Our whole goal is to ensure that premiums are as low as possible, benefits are as high as possible, and that you are as satisfied as possible, okay? You remember last year we made a change. We made a change over to OneSource. That change is always tricky, and we know that, we recognize that. The change in networks hopefully wasn't too dramatic. You've got the IHC network, you've got access to, I think, the doctors that you need. But we recognize that this last year was kind of a stabilizing year. With that in mind, this year there are 0 changes to the benefit plans. Okay? The benefits are identical to what they were last year. We're going to review those, but we're not going to go into a ton of detail only because they are literally identical. We'll be here afterwards to go through individual questions if you have some. I'm going to do some highlights. Justin's going to do the same with some of the other benefits that they're offering. But effectively, the medical plan benefits are identical. Now, with one caveat, okay? We started the year out with a pesky little deductible on the prescriptions, right? So those are not there now, right? Those were changed, and they're not going to be reenacted, so to speak. So, actually, first off, we haven't passed these out yet, have we?
I got you.
So yeah, do you mind, Justin? Thanks, buddy. So my lovely assistant, Justin, will be passing out.
It's true. I am the eye candy.
We can't afford adequate eye candy, okay? So we get the next best thing. So, and we'll go through that in just a second. But the bottom line is you won't have a deductible for the traditional plans that are offered. And remember, you've got 2 traditional plans and 1 high deductible health plan. And we'll go through a little bit of that in just a second. But while those are being handed out, just a quick overview on, I'm actually gonna have to free up one hand here. Okay, it's your job to make sure this doesn't fall out of my pocket, okay?
All right.
You just have to catch it. If it falls, you catch it. All right. So, ACA, Affordable Care Act, okay? I promise I wouldn't call it that because it's not that. So as it relates to the ACA and taxation, anybody who chooses not to have medical coverage right now, even though they kind of repealed, they didn't really repeal it, they changed the penalty or the fee for not having coverage. You recall that when they had that whole fiasco? Really all they did is they made it a $0 penalty in 2019, okay? Not in 2018. So they couldn't do anything until the next year. What that means is if you choose not to have coverage for any months in this year, 2018, you will pay a penalty or a fine from the federal government on your tax return in 2019. Does that make sense? I shouldn't say it that way. It doesn't make sense, but that's okay. It is what it is. As long as you understand what it is, then you're fine, okay? So that's what's going to happen in 2018. In 2019, you're now in a position where it's a $0 penalty. There is still a penalty. They can't repeal it without repealing the whole thing, but it's now $0, okay? So you're probably, if you were in that position, going to get something from the government that they paid money to send to you that says you owe $0, and congratulations, okay? So with that in mind, that's how that's going to work. Now, because you're offered coverage here, you do not qualify for a subsidy through healthcare.gov. That's a really, really important point. okay? Previously, your employer did not need to submit a 1095C form because of their size. Everything that goes through one source, because it's a large group health pool, will be submitting to the government or to the IRS a 1095C form. All that means is everybody here who's offered coverage that's eligible for the benefit, the government, IRS, will know that you were offered coverage that met minimum value and affordability, okay? That means if you went to healthcare.gov and they said, hey, based on your income and everything else, you qualify for a giant subsidy. Here, we're going to pay for most of your coverage. At the end of the year on your tax return, you'll have to pay back all of the subsidy. And that is a terrible idea, okay? Because that means you will have had to pay for insurance and you would have had no help for the insurance. You're far better off to enroll on the plan here. Are there any questions on that point? Because that's a very important point. You okay there? Okay, I'm pausing for effect. Okay, dramatic effect here. Okay, let it sink in and make sure if you have questions, call us because that's a big deal. If you're on healthcare.gov or you've got coverage through healthcare.gov, talk to us because that's an issue, okay? We don't want you to get penalized at the end of the year and have to pay back thousands of dollars. So with that in mind, last thing before we jump into the benefit guide is on the first page, you'll notice that we have contact information for our group. You've got contact information for Justin wants to be really clear that it is not him. Otherwise,
Scared me a little bit, if I'm being honest. It was like right here.
So on the first page, you'll find contact information for all of the aspects of the plan. Don't hesitate to contact us after this meeting whenever you need help. We're obviously here. Nolan's fantastic as well, but we're here to help Nolan and can certainly help you guys directly. Also, the benefits we're going to talk about in this benefit guide are all tax-free. Okay, so what does that mean? So you guys have heard me say this a lot of times, so what does it mean? Takes off of your paycheck, right? And what don't you pay on that money? Taxes. Federal tax, don't pay that. State tax, don't pay that. FICA, you don't pay that, okay? So you're saving about 30% on average, roughly about 30% off of every dollar that you buy with benefits here. So if you pay $100, your net take-home pay will be affected by about $70. That make sense? Same page? Okay, perfect. So let's jump in to pages 4 and 5. Look like this. Two traditional plans. And when we say traditional plans, really what we mean are pre-high deductible health plans. Okay, they're not better than high deductible health plans. High deductible health plans aren't better than these plans. We, I think, know that at this point. The key is on these two traditional plans, you will have co-pays that you pay when you go to the doctor's visit, when you go to an urgent care facility. So if you break your arm, we just moved into a new neighborhood, and within 1 week, this wonderful, sweet little neighbor girl broke her arm on our swing set. So it was like a nice welcoming gift to the neighborhood. So they went to the urgent care, right? If they were on a high deductible health plan, they would have had to pay the entire balance of that bill until they met their deductible. On these plans, how much would you have to pay if you went to the urgent care for a broken arm? I'll give you a hint. You just come down here where it says urgent care, go over to the right side, and what does it say as far as the copay? $75. I think that's right. I'm not looking at it, but I'm pretty sure that's right. Yep. Correct. So on the 6350 plan, it's $75. What is it on the 3000 plan? $60. Okay. Is that better than $600? I would say that less is better in that case, right? So the nice thing about traditional plans is every time you go, it's kind of a death by a thousand cuts, so to speak, because you're going to pay a little bit every single time you go, but you're not going to have to pay a ton for just one visit. The only time that you're going to have to meet your deductible is where you see claims below that say AD or after deductible, with one exception, okay? If you look at the RX on page 4, my wonderful team took off the deductible, but they forgot to take off the AD after the RX benefit there, okay? So that's a typo, and that's one that we'll take 100% ownership of, okay? That means traditionally after deductible, those are not after deductible, okay? You don't have any deductible for those prescription plans on page 4. The team back at the office has already updated this, and they've sent Nolan an email with an electronic copy that's updated. So you already have a new one, but these are already printed and they're here. So I'll just let you know what the difference is, okay? Does that make sense? So as an example, on the 3000 plan, you're gonna be a $15 copay for generics, not $15 after your deductible, okay? For your specialty drugs, Tier 3, you're gonna be 50%, not 50% after deductible. Does that make sense? Clear on that? Okay. I've got a no. So I'm going to say this a little different way, okay? There is no deductible when you go to the pharmacy. Okay, if you go to the pharmacy and you pick up a prescription that you've been prescribed by a doctor, okay, you will pay a copay or a percentage of whatever the amount is that's owed, period. You won't have to pay the $6,350 deductible or the $3,000 deductible. There is no additional deductible you would have to pay on top of that. Is that helpful? Better way of saying that? Okay, awesome. So one cool thing about these two benefits, the price at the bottom here, this is another thing I had my team update just a minute ago. This price down here at the bottom of the page, this includes the gap policy coverage on page 5. Now, I'm not going to have you raise your hands on who's used gap coverage, but I know there's a ton of people in here that have used it, right? Including myself. I've actually had a lot of gap claims with different things that have happened within the family. So the gap coverage is a huge resource to ensure that you have the best benefit possible. So let's run a couple of examples here, okay? You guys give me an example. I need, MRI is easy because that's just a standard thing. But what's something that you would go to the hospital for?
Broken arm.
Broken arm, okay. So let's talk about this for a second. Would you go to the emergency room for your broken arm, or would you go to the urgent care for a broken arm?
Emergency care.
Okay, you're outvoted. You just got outvoted. So everybody who said urgent care, why did you say urgent care?
It's not life-threatening.
Okay, not life-threatening. Are there circumstances where you may have to go to the emergency room for a broken arm?
Yes.
Yeah. Do we know what those are? Is there anybody here that knows what that is? Like what the differentiation is?
You're bleeding.
We can totally pontificate, okay? I just wanted to use that word, but we can totally conjecture about this, but we don't really know, right? It's up to the doctors. So if they think that you're gonna need surgery, then the hospital's the place to be. You don't know that, so what I would say is the default almost always is the urgent care, okay? For a broken bone that's not life-threatening, how about a broken femur?
Really?
Yeah, you're going to the emergency room, okay? Broken leg, probably going to go to the emergency room. Something that big. There's a little bit of a fine line there, but it's a good point to train on, okay? If you break your finger, or if you break your fingernail, then you're probably not going to want to go to the emergency room for it. Okay, clear on that one? Okay, so we're going to use this one as an example. Let's get another example. Why else would you go to the hospital?
Because you're sick.
Car accident.
Because you're sick. We're going to use that one, okay? Because you've got the flu. You wouldn't go to the hospital for that. We're going to use pneumonia. That's a better one to fit my example. How's that? Okay? What was the other one I heard?
Have a baby card.
Have a baby. I don't think you can have a baby, but that's okay. He said that? Can he have a baby? I'm sorry. I'm sorry. Fast forward 5 years, I'd probably be put in jail for what I just said. So redact it, erase that from the video. Didn't happen, okay? So we're going to go with maternity, whoever it is that's having the baby, okay? It's human and it's in your household. So if you have a baby and you're on the 3,000 plan, you're going to have a deductible of $3,000, and then you're going to have coinsurance after that of how much for having a maternity claim? Anybody see that there? 30%, good job, awesome. So if we have a $10,000 delivery, the first $3,000 will be your deductible, then you'd pay 30% of the difference between that, which would be 30% of 70, which would be $2,100, which makes it $5,100, right? For the baby. So the answer is yes. So that's what it is. Now you look on the gap page under the 3,000 plan, you'll notice for inpatient claims, you have a total benefit of up to $6,000. Do you see that on page 5 right here? Okay. So that means if you have a baby on the 3,000 plan and it's a $10,000 claim, you would owe out of your pocket $5,100. Of that $5,100, the gap plan would pay how much? All of it. Leaving you how much? Zero. Is that good or bad? It's freaking awesome. It's amazing. Okay, that's a really, really good benefit. By far better than the vast majority of employers out there. I just want to underscore that fact because you work for an employer that does a phenomenal job of offering and ensuring that you have insane benefits. Really, really good benefits. So let's take the next example, which was, I think we had pneumonia, and then we had broken arm, but I'm going to change that to like a broken femur. Okay, so you're going to the emergency room. So these are two emergency room claims. We've got pneumonia and we've got broken femur. Okay. Both of which you would go to the emergency room theoretically for, right? Pneumonia can kill you. That's not a good thing. Pneumonia is considered an illness. Broken leg is considered an injury or an accident, right? I guess theoretically it's not an accident, but it's still an injury. Either way, they're classified differently with Transamerica. both of them would be covered under whichever benefit you choose on these two plans, okay? If you're on the 6350 plan, your emergency room benefit would be $250 copay, then 0% coinsurance after the deductible of $6,350, okay? So you'd be paying quite a bit for either one of those claims on this plan. On the 3000 plan, same type of gig. Difference is it's a lower deductible of $3,000, but you'll also notice that it's a $300 copay, then 30% after that $3,000 deductible. Now, the reason I bring up these two examples, if you go in for an injury or an accident, the GAP will pay in the emergency room. If you go in for an illness in the emergency room, the GAP won't pay. Your major medical plan will still pay, but you won't have GAP assistance for the illness. And the reason for that is if they say that they cover illnesses, then that means that they cover colds and flu and all sorts of things that you shouldn't be going to the emergency room for, which then increases your utilization rate, which increases your rates, which makes everything problematic, okay? They're not trying to penalize you. That's just how it works. Now, if you have a heart attack or a stroke, which are both considered illnesses, but you're admitted to the hospital, which you will be. If you're having a heart attack or you're having a stroke, I promise you'll be admitted to the hospital. The GAP will then step in because you've been admitted. Okay? Same thing with pneumonia, right? If you have pneumonia, you go to the hospital and they say, oh, you have a pneumonia problem? Well, we're going to send you home and maybe give you some Tylenol. That's not what's going to happen, okay, unless they want you to sue them afterwards after somebody passes away. So generally what happens with those illnesses that are very serious, they're going to admit you and deal with the problem. The only one that I've seen, or I should say the most common one, is individuals who have kidney stones. Many times that becomes more of a routine thing for people. They'll go to the emergency room, they'll look at it and say, oh, we know what's going on here, and they'll send them home. It kind of is what it is, and I'm sorry, that's not a great answer, but that's one where the GAP's not going to pay for it. You'll have the benefit from the major medical carrier, but that's one of the loopholes in the GAP policy. And I would say that is the loophole, okay? If you have the accident injury, every single accident injury is covered 100% by the GAP period. Doesn't matter, like, if it's your head, your foot, your toenail, doesn't matter. It's going to be covered.
So you're saying if you're admitted into the hospital for an illness, the
If you're admitted, it'll pay, period.
so why would you ever have to worry about it not paying?
Because if you go into the emergency room with a kidney stone, they may just send you home. They may not admit you. Does that make sense? So like admission means that you're going to the emergency room and they say, all right, you're in the emergency room, we're going to admit you to a room in the hospital. Yeah, Josh.
What about other examples? Like what if you go to your family doctor and he orders an ultrasound or a blood test and sends you somewhere?
Good question.
How does that fit into
It covers major radiology and some simple radiology, and that line is blurred a little bit, but it doesn't pay for labs. So radiology is going to be ultrasounds, anything like x-rays, stuff like that. MRIs, CT scans, all of those things are covered. So if you have any of those things, those are going to be covered regardless of injury or accident. Injury, accident versus illness only matters in the emergency room. That's the only designation they have there. So if you go to your doctor's office, odds are the claim's not going to be covered by GAP, unless you have an MRI there, or you have an ultrasound, or you have something else like that. Does that make sense? So when you look at this GAP page, the easiest way to look at it is it pays for inpatient hospitalization, outpatient hospitalization, emergency room, it has an ambulance benefit, and then it has doctor's office surgical. So it has like a $100 benefit if you have a mole removed or things like that. It'll just pay $100. Most of those will be covered by a copay when you go into the doctor anyway, meaning for the small stuff, so to speak. Doesn't pay for prescriptions, doesn't pay for your office visits. It's intended to help you with your deductible and coinsurance and the larger claim items. Okay? Last item is on the GAP, it's two separate buckets. So you've got a $6,000 benefit for inpatient, an additional $3,000 benefit for outpatient. So for a total of $9,000 available to you, depending on what your claims are, what you have. So questions on those two pages, how the traditional plan works and the GAP plan? I'm taking more time than I thought I was going to take, but I think it's good time. Okay. High deductible health plan, I can cover in under 1 minute. How's that? Your company contributes generously to a health savings account if you enroll in your high deductible health plan here. The high deductible health plan pays nothing outside of preventive services until you've met your deductible. Okay, so when you look at this, very simple plan. Once you meet $5,000 as a single, the plan will pay 100% thereafter. As a family, once you've met $5,000 per person up to $10,000, the plan will pay 100% thereafter. If you choose this plan, the premium is less, which means that you can save up some money, put it into the HSA, and use that money to pay for claims pre-tax. In addition, your employer puts in, we'll call it a hefty amount per year, that allows you to use that money to pay for claims, or if you don't use it to pay for those claims, it's your money. It stays in that account for you. It rolls over from year to year, and you can take it out for whatever health-related claims you may have in the future or at retirement. Okay? I think that was under 60 seconds. Any questions about this plan, the high deductible health plan?
GAP does not apply to HSA.
Correct. GAP's not included on the HSA or the high deductible health plan. Any other questions or comments?
It just might be good to point out about contractual rates. Sometimes people are thinking these amounts and they don't realize the bill gets reduced.
The what, sorry?
Your bill gets reduced based
Yeah.
on contractual rates, so.
Totally.
It's just, there's a little bit of buffer there if you're having some out of pocket.
Yeah, absolutely. And that happens on both plans, meaning that the bill that's submitted gets reduced when it's repriced by the insurance. The insurance will have a contract with the in-network providers, but that is a good point. If we go in-network, that applies. If we go out of network, there's no such luck. So it's important to go to in-network providers and make sure that we do that to get the best benefit. But yeah, you do get a discount when you go in, so it's not just paying retail when you go.
30% of 5,000, they may reduce it by 1,000.
Exactly. You got it.
Will you talk about lab work really quick?
No.
If it's considered in visit or not, depending on where that lab work.
You know, I think it would be great. Do you want to take a second, Justin?
Sure.
Yeah, let's do it.
Okay.
Just on lab work.
So lab work, if you go into your physician's office on this plan, and they can do the lab work inside, I guess I can do this, I've got a loud voice, but probably not good enough to pick up on there. You know, I'll slide over here for Nolan's sake. If you go in for an office visit for your physician and they order blood work or something along those lines, if they cannot do that blood work in their office or their clinic and they have to send it out to an ARUP or other clinics, that blood work then will be considered on an outpatient basis because it's not, the doctor's office is not doing it. Most clinics nowadays do it, but some small practices that cannot do blood work and they have to send it out will not be covered under the copay when you go in, just so you know. There's been some confusion on that. So if they can, if you go to the clinic and they do it all there, that's in your copay, not a big deal. But if you go to your primary care physician, he orders some blood work to get done and you have to go someplace to get it done, or they have to send it out to get it screened, then it will not be covered underneath that office visit because obviously it's not being done in that office. Make sense? Okay.
Thanks, man. I wasn't sure which one you were referring to, so I thought I'd let you go through it. So yeah, and that's obviously for the traditional plans. So if you're on the HSA, they're all going to go towards your deductible. There's no differentiation except for preventive care. So questions on the medical plans? Yes, ma'am.
So on the lab work, if they don't do it in office and they're going somewhere else, how come there's not a way to get that pre-qualified? They're saying, oh, you just have to submit it and we'll tell you.
It's a different claim code, so it's still covered. It's just that it applies toward the deductible as an outpatient claim. So it's, in insurance speak, you've got ICD-10 codes, and if something's done in an office, it's coded one way and it's less expensive. If it's done somewhere else, it's coded a different way and it's paid differently. Does that make sense? So it's less of an issue of what's done where, but generally it's like, as an example, if, so I was ill 3 years ago or so, the doctor wanted to do heavy metals testing on me, and I said, okay, that's great. So he did it, and I can't even remember what the result was. Probably like, yeah, rock on, this is awesome, but effectively I had to pay for that entire test because it went toward my deductible. Does that make sense? And it was a separate test outside of the normal things that they were testing for in their office visit. So as far as pre-qualifying, it's not really a pre-authorization issue. Does that make sense? I don't know if I'm explaining that well enough for you.
Well, I was just confused when I called pre-authorization. Will all these tests be covered and they said you can't take them?
Yeah, so as far as pre-authorization, if the doctor calls and gives an actual ICD-10 code and says, here is the code that's going to happen. So this is a question on prior auth, on what can actually be pre-authorized, right? So when you call into the insurance carrier, or the TPA in this case, they're not going to be able to give you a guarantee of benefits over the phone. In fact, when you call in, it will actually specifically say that, right? It says it right out of the gate. Whatever we say here is effectively is not a guarantee of benefits or something to that degree. And the reason for that is if they did that, then, I mean, I won't go down that road, okay? The doctors themselves are going to determine what is submitted and what's not, and then the plan will pay based on the plan document. If the doctor wants to obtain prior authorization, they can do so by submitting the ICD-10 codes that they are planning to do based on medical necessity, and the plan can then provide prior authorization for that. Now, there's some things that are required. So if you're going to go get a surgery, you're going to need prior authorization. If you're going to have a hip replacement, if you're going to have something like that, that's going to require prior authorization. And then a panel of doctors will look at some of those things and say, you know what, have they done, there's this thing called step therapy, that they don't want people just having their hip yanked out as an example unless they've done therapy or things like that. But as a general rule for prior authorization, the only time that we as patients will pre-authorize things is to the extent that that we're advising the insurance carrier that something is planning to happen, so they're aware that they should be expecting to hear from the provider to finish that pre-authorization. Okay? So that needs to come from the provider for a final determination, but then remember, they could change it and then it may be not covered if they did something different. So you could get a pre-authorization for one thing and they say, no, we're going to do this, but then obviously that wouldn't be covered. Well, if it wasn't a covered benefit. Okay, yeah, go ahead.
So is this still IHC, and what labs would you use, and can you get a hard copy of the provider list?
So yes, it is IHC. Yes, you can get a hard copy of the provider list, but the hard copy is only available if you print it. So you just have to have a printer that you'd wait for a long time. But you'd go to the same network locations. So on this page right here, you'll notice on the provider lookup, it's the top left, right? Sorry, here. So the network is Health West. That includes all of IHC and quite a few outlying provider locations and clinics. And you'll be able to find all the providers that you need on that. There are a ton of them. Very broad and expansive, but yeah, it's IHC based. Good question. What other questions? Yes, sir, around the corner.
Can you reiterate what's happening with the prescriptions that's different?
Yeah.
It's not stating that, so it's obviously just different.
So on the page that you're on, if my eyes don't betray me, you're on the high deductible health plan page, right?
Well, I was looking at 4, then I flipped to 6, but I'm just reading it says just the percentages after deductible,
Yeah.
things like that.
Yeah, so the AD on all of the prescriptions for the traditional plans, both plans, just scratch them out, they don't apply. Does that make sense? On the high deductible plan, they obviously do apply because everything applies to that same deductible.
Okay, but on the traditional, it's not what it says here.
Correct.
Okay.
That's the typo that we were addressing at the beginning. You got it. So the electronic copy that Nolan has in his email right now has those gone. And it'll also have a little thing at the bottom of that same page somewhere that says gap included with the rates that you're paying, basically. Good question. Any other questions? Going once. You all already know this. I wait like 4 or 5 seconds, and it's awkward, right? It's like that awkward silence. We'll all say a prayer or something while we're waiting. So, yeah. So, okay, yes, thank you. So, it's on there under telemedicine on all of the medical plans. Yeah, and he's got a full page and everything as well, and we've actually got handouts, and there's one thing, so you stole my thunder, Nolan, and that's okay. Because I like to end on this one, but remember it right now, because with Healthiest You, but let me ask you this, who's used Healthiest You this last year?
I found out yesterday we're supposed to. That's
Okay, so who was here in the meeting last year? I know you were, Josh.
You the app thing?
Yeah.
Okay, I just didn't know what it was.
Okay, yeah. So the app thing, has anybody used the app thing, the telemedicine, right? Okay, so be honest with me if you want to share your experience. Who had a good experience? Okay, good. Who had a bad experience? So no? Okay. So in every meeting that I've been to, the first year that we've done Healthiest You, inevitably there's good and bad. Let me describe the bad that I'm most aware of or have seen, okay? One, I got a grumpy doctor, okay? That may apply here or may not, I don't know. But honestly, that can happen. Every once in a while, you call in, you get this doctor, and he's kind of a turd or she's a turd, okay? And you have to call back, okay? The second one is if you don't pre-register online, you should be pre-registered already automatically.
Everyone's
okay?
already enrolled into it right now.
So you're automatically enrolled, you don't have to pay anything, all of that is automatically updated, but let me give you an example here. If we've got, let's use Nolan, I'm not gonna pick on you, okay? So we're gonna use Nolan. So we've got Nolan, he's enrolled in the plan, but he hasn't enrolled his wife or any of his kids or anything else like that, right? You have coverage for everybody in your household by you being on the plan. But through the plan only knows that it's you enrolled, okay? So when you go to use it for you and your household, you're gonna have to update them to let them know who's in your household. Does that make sense? But if you just call for you, your information should be in there. So anybody who's on the health plan, if it's you and your dependents, will automatically be enrolled and included in HealthiestYou. Step one. As it relates to the good and bad experiences, those individuals who have called in and have had to do some pre-registration stuff, that can be an issue. The second one, at the first of the year, HealthiestYou had a giant dropping of the ball, okay? We had about 20,000 employee lives that are on HealthiestYou in our block alone. I mean, this includes OneSource and all sorts of other people, where HealthiestYou just kind of messed up the enrollment, okay? So if you tried in just after January last year, somewhere in between about December to about January 20th, somewhere in that range, then give them another chance, okay? It's a big flat pass for me because Teladoc came in and bought HealthiestYou, they merged, and their systems had some problem talking to each other, okay? So that's the second one. The third one is simply that people haven't understood exactly what HealthiestYou is for and how it operates and what it works for. So to the very last one, let me tell you my experiences with HealthiestYou and how I felt that it actually works best, because we use it as our first line of defense for anything that's not urgent care. I'm pointing to you because we talked urgent care here, right? Or emergency room, when we talked about that. So for me, if my child falls, gets a cut, and I wonder if they need stitches and it's not life-threatening, guess what I do? I call up HealthiestYou. If I have the app, and you can download the app, you can get on a teleconference with the doctor. You can request a teleconference. You can request that they call back. The average callback time right now is 12 minutes.
Is it a video call?
If you want it to be. Doesn't have to be.
You request.
Yeah, either way.
Yeah, you're like, I want to do video, or I just want to do.
Correct. Yeah. So the average is 12 minutes. I've found that in my case, I've had 72 visits, okay? A lot, because we literally use it for everything, and it's good for me to have examples. It's great. So I call them for the tiniest of things, okay? So I got a cold sore the other day. I was like, called them, and guess what? There's totally this new pill you can take that's gigantic, that if you're having a cold sore coming on, you take it, and poof, totally goes away. It's awesome. But the point is, I didn't have to go to the doctor for that. I didn't pay a copay. I didn't pay anything. All I did is call up HealthiestYou. They told me about it. I went in, I filled the prescription. That's it. Didn't cost me anything for the phone call. Is that a good thing or a bad thing? It's a good thing for you guys in two ways. One, it costs you less money when you call. Two, I'm going to think of three things here. It costs you less money when you call. You don't have to go to the doctor's office, right, and sit there with everybody else who's sick. And at the end of the year, you've incurred less claims on your insurance plan, which means your rates stay low. So the more utilization we have on HealthiestYou, and we have some groups that have 25% utilization, what that means is of all of their office visit volume, they're utilizing 25% for all of their dependents, meaning 25% is going through HealthiestYou. That means that the plan's paying 25% less for all doctor's visits. That's huge. Yeah, go ahead.
So they're able to actually write a prescription for you?
They are indeed. And when we say write a prescription, what we really mean is submit an electronic prescription to the pharmacy of your choice and let you fill it, right? Go ahead.
Unless the doctor says, no, you need to go in and see your physician.
Correct, but they have the ability to do that. Now, the only things they can't do is any controlled substance they can't do.
Opioids,
right?
painkillers.
Yeah, so.
If somebody had an infection, for example, and
Totally.
they get a Z-Pak prescription.
Strep is one of the most common. In fact, the most common one is pink eye, honestly. It seems like for me, and this is me making it up, it may not be the most, it may be nasal infection or something else, but I see pink eye on there all the time in our reporting. Because people just call in, they look at it like, oh, clearly we know what's going on, they call in the prescription and away they go. Now the nice thing is how long does it take you to get into your doctor? Just out of curiosity. I don't want to bore you with this, but since nobody is using it, this is one of the coolest parts of your health plan, and I just hope that you leave here with nothing else feeling like, hey, Achieve Today is taken care of. So they're paying for this 100% for you guys, so you have no cost to use this. But how long does it take you to get in to see the doctor? I'm just wondering if my experience is any difference. Yeah, what was that?
I had an appointment on Thursday. It took me about 25 minutes to
So it took you 25 minutes. How long did it take you to get your appointment for Thursday? Was it the same day?
just called in.
Was it the same day? So apparently I either have a really busy doctor or otherwise. I can't get to see, like if I want to make an appointment with the doctor, it takes me at least 2 to 3 days to like get an appointment. And then I go to the appointment and then I wait in there with a room full of sick people. No offense to the room full of sick people, but I'd rather not go in with what I have and come out with what they have. So when I go in, I'm there for a long time. I get in, I see the doctor, then I pay him or her a bunch of money, and they tell me something that many times I already know, especially if my kids have had strep. It's like, look, I've got strep. What do you want me to do? You know? So the thing that's nice about it for me is I can do it in my home. I can do it in the middle of the night. What is your option in the middle of the night? Emergency room. That's it. If your kid has a fever in the middle of the night, the emergency room is what it is, okay? And I think I shared this example last time, and there's cases where you may call and they may say, you know what, you're better off to go. Just know that that's not been my experience in 72 claims so far. It's not been my experience that that's their default answer, okay?
90% they're able to diagnose on the phone.
It's very high.
Get you done.
So, and about 60% of the time, it's just under, for the last group that I looked at, it was like 58% of the time, it resulted in a prescription. So to your point, about 60% of the time, there's a prescription that's written. So I had one experience where I had taken a medication for a sinus infection that I had. It was, I think it was a Z-Pak or something. It was some new antibiotic. The next week, I was down in Springdale doing open enrollment meetings for hotels down there, and I ended up getting this weird reaction that turned out to be a reaction from the antibiotics that I was taking, but we weren't sure what it was. It was I was losing kind of feeling in my arms and was really tingling, and it turned out to be like a sun reaction. Anywhere that was exposed to the sun, it was doing its own thing. But it was mimicking the symptoms of Guillain-Barré. And if you know what Guillain-Barré is, I didn't know what it was. I do now. It's effectively an infection that happens after an infection. So your antibodies get built up and then they start attacking your nervous system and you start getting tingling feelings in your legs and things like that. And eventually it shuts down all of your nerve systems. You go into a coma, and if you're not in the hospital, you die. So at that time, there's one of two options. Either you got Guillain-Barré and you're going to die unless you go to the hospital, or it's not Guillain-Barré and you're having an allergic reaction and you're totally fine. So in that case, the doctor said, I think it's best that you go to the hospital because the Nash equilibrium on that isn't really good. You know what I mean? Okay. So there's going to be situations like that. So I went to the hospital. I sat there all stinking night because that's what the hospital does. They don't want liability. So I sat in an uncomfortable bed with an IV and just sat there and did nothing while they came in and said, so can you still talk? Yep. Okay. We'll come back in an hour. And that's really all you can do for Guillain-Barré. Okay, does that make sense? That was a big expensive claim for me, is my point. Guess what? The Gap didn't pay for it. Why? It's an illness, and I wasn't admitted. No. I was in the emergency room just sitting there for that night, right? Admitted means that you go into a room in the hospital and they actually admit you to the hospital. So in the emergency room, that's separate from the hospital. It's not the same thing, two separate claims. So Gap didn't pay for it. I had to pay for it out of pocket. Am I glad I did it? Heck yes, because the alternative could have been disastrous, okay? So if those are bad experiences, I'm okay with those bad experiences because they're going to happen. I've got 71 other experiences that saved me a bunch of money and worked really well. So those of you who have bad experience, I just encourage you not to give up on it because I promise you that it's working for a lot of people, including me. I've had a lot of good experiences with it. And remember that if you get a doctor that's not helpful, literally hang up and call back. And you could even mention, hey, this doctor was not helpful. I'm sorry. I'm sure it was just a bad day, bad experience, but I need to set up a new appointment with somebody else.
Where's the talk about that?
Okay. So, yeah. So we have separate handouts and whatnot for Healthiest Youth that are big and blaring and whatnot. But if you go back to, sorry. They don't have this in the front. I'm going to have them add it today and send it electronically in your contact information at the very front. And it'll just have the telemedicine phone number to call on the very front. Justin has some things as well that they can send back out. But as far as the, but we want to have that in here of where you actually call. So I'm going to have them add that to the contact information on the front.
There's a toll-free number to call, but honestly, I've never used it.
Yeah, the best way to do it is to look up the app.
Person I'm calling about puts me in the queue, like which video or phone call, and then they call me back.
And do you all have your phones with you right now? Nolan, are you okay if we take just a second? Have everybody look it up, just so that you're all aware of where it is. So what's it called on there? I don't think you can look it up with, can you look it up with Healthiest You?
Healthiest You. It's a white little box with the orange HY on it. Yes, he's got.
What's the actual app called? Is it Healthiest You now? Okay.
Is it like YOU or just you?
Okay. So when you see that, and again, that's Android, iOS, it's there, it's available to you. If you go on there and you input the information, not all of the information there is required, to be frank. So you can start with a minimum of information, see if it goes through. If not, add a little bit more, do a little bit of trial and error. You don't have to look for every little last piece of information.
It's your date of birth and your name.
Those are the two most important.
Yeah, it's whether or not it's valid or not.
Yes, that one. So what does it say? Yeah, that's what I thought. So it'll just be HY. So literally, if you just search for HY, then you'll be able to find it. What was that? It could be. Yeah, look at it and see. You find it? The problem is iOS and Android, it actually looks, if I remember correctly, unless they've changed it, it looks different. So I don't know if that's what you guys are looking at. So yeah, once you go in there, that's going to be your very best resource. And the reason is your benefit guide is going to probably either go in the garbage, or it's going to go to a significant other and then in the garbage, or it's going to go to a significant other and then in a file drawer. So if you have this on your phone, which we've already evidenced that you all have phones here, okay, then you know you have it and you can use it at any given time, okay? That way, if you need to look things up, there's actually an RX drug calculator in there to save you money on RX drugs from different pharmacies, which is awesome, works really well. There's a lot of different functionalities in there that are pretty cool. Okay? Everybody able to find that? That's, in my opinion, we'll still put it in here so you've got the number in there, but that's going to be the very best way to do it.
Use that because it puts you into a queue. They call you back. It's awesome.
A lot of times it's a lot easier.
You don't wait on hold.
Yeah, exactly. Any questions on that? Okay. So the last 2 points.
On that?
Okay.
So I would have to go in and register my husband for it.
If he's not on the medical plan with you,
He's on my medical.
then he wouldn't.
Then you don't need it. He's already.
It's only if you have a dependent that's not on the plan.
Yep.
See, boom, and he did it just that fast, right?
Now again,
See?
you want to add your dependents on this Healthiest You. They do not have to be on the health insurance to be part of this. Just by having you enrolled in the health insurance, you can have access for all of your dependents on there. You'll just need to let me or Nate know, and we will add them in. Okay? But we'll need to know date of birth, their names, and social. That way we can notify Healthiest You and include them in it. Okay? It's a pretty sweet benefit for you and for your employees.
And a lot of times they can actually call in too,
Yeah.
if you want to call in. So if you want to call in and add them, you can usually add them on your side or go online. That's easier, quite frankly, usually. They may have a question about it. If they do, you can contact us. But the bottom line is it's a solid service. It's really awesome, works really, really well. And next year when we come around, we would love to have more hands, and we have reports, so maybe we'll start looking at the reports specifically for you guys and see how many people are using it through the year. And granted, you don't have to just use it whenever you're lonely or whatever, but just use it when you need it. You're not going to need it all the time, okay? But effectively, it's going to be a huge resource for you that I know you're not using as much as you could be, okay? On dental and vision, no changes at all. So maybe that's the best way to leave it. But when you're looking at the dental plans, you've got 3 options. You've got a discount plan, that's only discounts. You're not gonna have any insurance coverage on that plan. Okay, it's great because you get those same discounts we alluded to earlier that are very aggressive discounts, but the plan's not going to pay for any of the services that you receive. The next plan up, you're gonna have great preventive care coverage for cleanings, exams, and x-rays, major and orthodontia, things like that. You're gonna have more discounts than coverage. Okay, it's mainly for your preventive maintenance. That's next plan up, that Summit. The Pinnacle plan is gonna be your very robust, all things covered, all hands on deck type plan. Okay, so obviously that one costs more than the other two. All of them are good, and I will tell you that if you go to the dentist in this room and you're willing to go to one in-network, you're better off to have one of the three plans than you are to not have insurance at all. Period, every single time. Because they're tax-free, it pays 100% for your preventive care. If you get your preventive care done, it pays for itself and you're good to go. Okay, so dental is a no-brainer. Vision coverage, very simply, you're better off, now it's kind of unequivocal, if you want a price value with the vision plan and you have a need for vision. If you don't have a need for eyeglasses or contact lenses, don't buy the vision plan, doesn't make any sense. But if you do, you're better off to get the prescription from like Standard Optical or somewhere like that, then go to Costco, Target, somewhere else, a discount store, and get the materials. Even though it's a lower benefit, you're better off because the price is much, much lower overall. So the benefit goes farther. Okay, and that's all I'm going to go through on dental and vision. Any other questions on those? Okay. Quick summary wrap up. Your group is a great group. You're doing a good job. We can improve on healthiest utilization. Okay, that will literally save your plan money, and next year your plan will not go up as much. I promise you it won't. If you do the right things in the right way, I can ensure that your plan will be the best benefit possible in the future and that they can continue to pay as much as they're paying. You're paying a very small portion, and hats off and hands off to Achieve Today for that. Question?
Is there anything in here on the flex bill?
I'm going to talk about
He's got it. You got it. So with that in mind, on that last point, Achieve Today, every time we meet with them, their first priority, the overlying priority, underlying priority is all of you as employees. So I hope at the end of this, you just send a quick email to Nolan and say, hey guys, I don't know who made this decision, but this is awesome. Because the benefits really are good. And I'm not saying that because I orchestrated them. I'm saying that because if you have a baby, it's going to be free for most of you. If you have a giant issue, if you have a broken femur or whatever, it's going to be free. There's not going to be any cost to it if you're on the traditional plan. It's a very robust plan that they've created, and they're paying the vast majority of the cost. So that's pretty cool. Do you have another question?
Yeah, I think it's important to note, because not everybody would catch this. I did this week using the insurance.
Yeah.
Your card says Health West. Not every company or office has that name into it, so, but we're on the Health EU network, I think is what it is.
It'd be the Health West network. Health West
No,
network.
there's another thing that pulled up for me when I called Health West.
Health West or EMI.
No, they said Health EU or Health U.
There's a Health Utah network, but that's a different network.
So when I called the doctors, I called the insurance first, they couldn't find my doctor. When they found my doctor, they said, you can go there, they need to bill under Health U or Health EU. That's the network that we use through the bill.
So Healthy U is a completely different program through the
It
university.
might be the Medicaid, I'm thinking.
Exactly. Yeah.
But my point is my doctor did not have the insurance and they're on it. So I don't think they're not covered just when you call the insurance.
Yeah.
Call the company first.
Yeah, so as a practice, so maybe like bringing that together, because I think I know what you're saying exactly. You don't know all the acronyms that we deal with on our side, and it's tricky. With that in mind, if you're looking for providers, go to the provider lookup site, basically, that's in there. Look up those providers. If they're not listed, talk to the providers, because there's times where the providers may not have made it to the list yet. That's always in flux. And if you have any questions, contact the number on that Health West lookup. Okay, so when you look up the providers, there's a number there to contact. You can call them and find out. And even if sometimes the doctor's out of network, if you call Health West there on the provider lookup site, you can actually get them added, which actually happens somewhat frequently. But that's a really good point.
I went to the University of Utah clinic, and they didn't have the insurance at all. But then I called the insurance, and they had all the doctor's names. And they said Health U or something else is a network that can bill to Health West. So I know for a fact that there was something else as far as a network, because it says it on the card.
We'll want to talk about that one afterwards.
On an individual basis, if you're having an issue with a claim or a doctor or whatever, we can handle that on a one-off basis.
Because I called 3 different offices.
Probably not in a group setting is the best way to handle this. On an individual basis, if you're having some issues, then we're more than happy to get into the weeds with you.
Well, it's not a single issue. I'm saying if they don't know the network is there, they need to ask.
Yeah, and I agree.
They say no when it actually is.
Yeah, the only reason I say that is the University of Utah is not in network for your group, unless there's a specific diagnosis. Okay, go ahead.
The whole clinic.
have a paycheck provision on the medical plan, or is that just?
There is, but it's not worth it. It's the basic from Obamacare. Okay, so it's basically the one that you go in and you read the lines. I shouldn't say it's not worth it. It's not worth it for me.
They're not going to do anything else outside of that.
Exactly. So it's basically the one where you come in, you read the lines, and you check a couple of things real quick. So there is one in there. It's once every 2 years, but it's not as comprehensive as you'd want it to be. It's not the one that generally people would want. It's a really good question. Any other questions? Good? Okay. Thank you so much again. You're up.
Okay. I literally am going to take maybe 12 minutes. Somebody get a watch out, time me, okay? We're going to go through. Nolan, go. First, I wanted to let you know that there is a lot of time and effort that is put in for management and ownership to make sure that you guys have the best benefits possible, and specifically Nolan. He spends a lot of time on your behalf making sure that these things are of benefit for each and every one of you guys. And a round of applause for Nolan is a big deal, trust me. Countless hours, okay? All right, so Nate, thank you for the time that you've put in with this. I want to talk about the flexible spending account. I'm going to talk about 401k, and then just a couple of other ones. If you've got some questions, you can kind of pull me aside after, and we can talk about that. First and foremost, flexible spending account. The IRS will allow you to withhold money out of your check. This is your money, goes into a savings account, okay, and you will have a card. It's a Visa card that you can then use for co-pays, for office visits, pharmacy, dental, eyeglasses, LASIK surgery, right? Anything medical expense related, except for voluntary stuff like cosmetic surgery, that doesn't apply to that. But everything else that's not covered inside of the health insurance where you have to pay a copay or you're into your deductible that might not be covered by GAAP, you can use your flexible spending account. The maximum amount allowable that you can withhold in a calendar year is $2,650. That's the most, okay? You have 2 times a year that you can, or 2 times that you can enroll in the flex. First is when you're first hired, okay? The second is at the end of the year. This is the only benefit that you have to re-enroll. The IRS forces you to enroll every year into this. We send out notifications to everybody, usually in the late November, early December timeframe for 2019. So if you're currently not on the flex and you would like to, if you're in your new hire eligibility period, fantastic, you can do that. If you're not and you haven't participated, then you'll have to wait for December in order to enroll for January 1st, okay? Now also, this is your open enrollment period for all benefits. Whatever you elect now, you have to live with for 12 months with the exception of life-changing events. So if you get married and you want to add a spouse on, you can do that. Birth of a child, you can add that birth of the child on. Keep in mind, okay, this is a hard and fast rule. You have 30 days to do that. You can't call me 60 days later and say, oh, Justin, I'm sorry, we had a baby, I need to add the baby on. You guys already knew that we had the baby. We don't know that you're going to add the baby on until you actually do, or when you get married, or if you have an adoption, or a divorce, or whatever. So you need to notify us, but you've got 30 days. Keep that in your mail-in, right? 30 days. That's what's going on, okay? The second thing that's part of flexible spending is you can do dependent daycare. If you have children that you're paying money to have in a facility, or it can actually even be family, you can withhold money out of your check pre-tax to pay for the daycare. That's awesome, okay? Up to an additional $5,000 per year, okay? That's not on the Visa card. You have to submit a reimbursement for that, and it's a pay-as-you-go. The medical flex, just so you know, if you elect to have $1,000, you have immediate access to all $1,000, and then you pay that back interest-free, tax-free for the rest of the year. Okay? Make sense? All right. So that's flexible spending. If you have some other questions about that, come on up and talk to me. I've got some forms here that you can sign up now, or you can wait until the end of the year and we'll get the information to Nolan, or if you're currently on the flex, then you can re-enroll in that. Yes?
So with the flex spending, the medical.
Yeah.
You have to use that full amount in that year's time, right?
Great question. So there is a use it or lose it provision on the flexible spending account. Anything over $500. So 500 will roll over from year to year. Okay? It used to be the use it or lose it. If you even had 50 cents in there, you would lose that. Now it's $500. They've, no pun intended, but the IRS is a little more flexible on the flexible spending account than they used to be. Okay? Good question. Okay? Any other questions on the flex?
Yeah.
Yep.
Can I pay a past bill from a year ago?
No. Date of service has to be from when you've enrolled and moving forward. That's a good question, though. Okay? Has to be date of service from when that happened moving forward. Okay? Awesome. All right. In addition to the health insurance and the dental and the vision, the flex, there is a 401k that you guys have access to that is being sponsored by Achieve. Really cool deal. We use Lincoln Financial. They're a huge multi-billion-dollar 401k provider. Right now there isn't a match, but you can actually withhold monies out of your check up to $18,500 per year. Okay? If you're over 50, you can actually accelerate that an additional $6,000. You can do it either pre-tax, so just a regular traditional 401k, or you can do Roth. You can decide how you want that coming out of your check, okay? You can decide to enroll or unenroll in the 401k at any time. Okay, you don't have to wait for open enrollment, because really, if you take a look at it, it's your money, right? It's just coming out of your check, and then you're taking that and putting it into a 401k. So you can make changes to that at any time. You do need to notify us and fill out a new form saying, hey, I'm going to make a change. I want this coming out, whatever. So you need to figure out how much you want to take out of your check. You can do a flat dollar amount, or you can do a percentage. Totally up to you, and you can change it at any time. You can even split like $50 coming out pre-tax, $50 coming out of Roth. That's totally fine. Once we take that money, we forward it on to Lincoln, and then it sits into a default investment account where it's just subject to the market, and it's going up, it's going down, it's doing all that. And then you can actually change where your money is at any time online at Lincoln. You can go on, log in, and there's like 40 mutual funds to choose from. Right now, the default investment account is with Stadion Money Management, where you actually have a live person that is overseeing those accounts for you based on your age. Okay, you're defaulted based on your age. So younger folks, your 95, 98% of your money is going to be in the market, and if you're 62, most of it's not in the market. You're going to be in safe, stable accounts, right? If you have questions on that, I'm more than happy to show you how to log in, get information on that, and I have some forms here that I'll just leave if you want some additional information, how it works and what's going on. How to access your Lincoln account is right here, how to log on. It's pretty straightforward. You can roll money over from other 401ks into this one. So if you've had some past employers and you've got some money there, you can roll it over into here. It doesn't cost you anything to do that. It's pretty straightforward, and I would help you out with that. Okay? Two other things. Life insurance. If you would like some additional life insurance, it's completely voluntary. It's up to you. Guaranteed issue up to $175,000. That's a fancy way of saying that it doesn't matter what your health looks like, you're not going to be tested, up to $175,000. It's awesome, okay? You only have that no testing provision the first year that you're employed here. If you've been here for 2 or 3 years and you haven't done it and then you want to do it, then you would have to be tested, okay? And they just come in and draw blood and urine sample and weight and height and all that kind of stuff. Not too big of a deal, but it's kind of a pain. So, but if you're here for the first year, fantastic. You can go out. It's very inexpensive to get some additional life insurance to help out in the event that you're no longer here. There are costs to bury you. I know that sounds morbid, but there really is, and that onus then goes on to your family in order to take care of those types of things. Okay? And last thing is there's an accident and critical illness. insurance that's available to you, the accident is exactly what it sounds like. In the event that there's broken bones, dislocations, accidental life insurance, those types of things, if you have an accident-prone family, something to look at. It's really inexpensive. And then critical illness is specific to specific diseases and illnesses that might occur, like cancer, heart disease, strokes, heart attacks, those types of things that would pay you lump sum amounts in order to help you with either deductibles or missing work. They're very inexpensive. It's like $10 a month to get like $20,000. I only recommend that in the event that you have a history of cancer in your family or a history of heart attacks or heart disease, something to take a look at. If you don't, then I probably wouldn't be interested in doing something like that. Okay? Questions? Yes?
Is that Colonial Life?
Yes.
Have that?
Yes. So if you're currently enrolled in these benefits, there's no price changes, no changes to anything. You just keep on going. Okay? You only need to fill out a change form on the health, the dental, the vision, the life, or anything else, or the 401k if right now you want to make a change.